All right, so I wanted to present my poster for my introduction of my dissertation. So what I wanted to cover was self-treatment plans in strength-based athletes with joint pain. Essentially, I wanted to explore what strength-based athletes do when they experience joint pain, like overuse injuries or acute injuries, to see what they do and if they're effective. So I'll explore more of that. But first, the background information. Powerlifters and bodybuilders is who I'm targeting when I talk about strength-based athletes. So we know that they do, injuries do occur, and with the research that I found, most of the injuries they found in their studies occurred in the lower back, the shoulders, the elbows, things like that. And with the exercises that were kind of the culprit being the big ones like squats and bench press and deadlift. So one of the studies showed that a lot of the time what these athletes try to do before they get injured are things like the bench press shirts, those ones that are kind of tight on the chest to help kind of slingshot um, your elbows and everything, your shoulders to have a more powerful press, and also things like elbow sleeves. So these are things that they do to help prevent these injuries. Um, Things in kind of more in a deeper dive, another study showed that these athletes, there's a lot of things that contribute to injuries, such as using like an different kind of training methods, like training to failure, which is a high risk going to failure, versus using RPE scales, which is more safe. Improper biomechanics, things like where your hands are on the bar for bench press, the width can be different for each person, and that could contribute. So, biomechanics overall, and all those combinations of training to failure and biomechanics. So, those things contribute to powerlifters having these different kind of injuries. And then for bodybuilders, same thing. The injuries occurred same thing in the back, the lower back, the shoulders, the elbows. A lot of it had to do with acute injuries more than overuse injuries, but there were, of course, overuse injuries as well in that population. So those things occurred in those two athletes that I'm targeting. Now, the problem statement that I wanted to explore was what methods do strength-based athletes seek to mitigate joint pain? And do these methods work? So I wanted to do a survey, and which we'll probably get into in the methods chapter, but I wanted to explore what methods these athletes do, and whether it's something that has worked for them in the past or has not. And we'll kind of go into the significance of the study in a little bit. Some assumptions and limitations. I'm assuming that everyone will answer the survey truthfully and that everyone has similar experience in the sport. I'm hoping to get people that have a little bit of experience, not really beginners, where injuries would occur a whole lot, and they don't have a lot of experiences of what they do. So a little bit experience, but not a whole lot. So we can see what they do, and hopefully we can see that. Other things and assumptions, the methods that they've picked allow them to continue to train, so it's good enough of a method where they can still train. Um, and if it doesn't allow them to train at all anymore, then we can kind of alter the study, of course, which I expect would happen a whole lot. So the gaps in the research that I found was that there wasn't really any research showing what methods these athletes do. So there's a whole lot of research that shows what athletes should do and what kind of injuries do occur. So the whole idea of this, my idea is to not really explore what they should do because that's very abundant, but more of what do they do before they're told, hey, you should be doing this, or you should seek a physical therapist, or you should go to the doctors and get an x-ray, stuff like that. What do they do before any of that happens? And there's not really any research that shows what occurs before the proper medical protocols happen, so or interventions rather. So there's research in that and or gaps in that and a gap in what different trends that these athletes do. My hypothesis is that that all these athletes do have some sort of self-care method to their joint pain, and that they may not have enough information or seek enough information to see if their methods actually work. So my hypothesis is that they all will be doing something, but we are trying to see what that something is, what the common thing is. Um, the definitions is when I keep saying strength-based athletes, I'm trying to kind of zero in on athletes that have to participate in resistance training. So powerlifters are all about strength. So if they get, elbow injuries or shoulder injuries, cross training for, aerobic training is great. They should probably do that, but they have to focus on power, and that's the whole point of their sport. So if they move away from that, they don't have a whole lot they can really do, so they have to take care of that joint pain in order to continue to improve in their sport and become more competitive. Same thing with bodybuilders, although that kind of depends on the season they're in, if they're cutting, bulking, whatever. But of course, resistance training is a big chunk of what they do, and I want to capture them as well because joint pain is going to hinder their progression into their sport. I could probably capture others like football players and things like that, but just kind of the access I have, I train powerlifters and everything is just kind of an easy way to get to that population, as well as bodybuilders. So the significance of the study, I'm hoping to really illustrate the trends and methods that these athletes use in order to enable medical professionals like physical therapists and things, enable them to really anticipate what kind of methods they're going to see. So let's say, a power lifter goes into a physical therapy office. Hopefully they can use my study to say, okay, well, they're probably just throwing, kinese tape, or they're throwing sleeves all over the place on them and hoping for the best. So I can really get ahead of that and use that to change my approach to how I'm going to treat this athlete. So hopefully it kind of opens, other professionals' eyes in what they will expect them to do based on what hopefully I find. Um, so that's what I'm hoping the significance of it is. My references are there, and I'm excited to see what questions my classmates have. But thank you for listening.